Katrina, tell me about the upcoming, I guess it's called Run for Life.
It is. We're kind of excited. We're teaming up with Runners North. They're sponsoring the run, and we're going to be offering some services here at Cache Valley Specialty Hospital before the race as well as after the race, so we can kind of showcase and give some screens to some of the folks coming out to race or to watch.
Well, it's a great event, and it is teamed up with Specialty Hospital, and Cache Valley Specialty Hospital is so good about working with the community, wanting to be involved in the community, and this is, I think the proceeds are going for a great cause.
That's correct. She's organized this run so that those who may not be able to afford screens will be able to have some funding that goes towards that, and so some of the proceeds will go to that. And then of course we want to let everyone know that we have those screens here and that we're able to do all of those services, and that we are truly a facility of choice, that you can choose to come here, and that we do have premium and premier services here for you to use.
Well, you are the premier hospital here in the Valley, and you really have offered such great care over the past several years. And this campaign for this run, culminating to the 5K run, has been a campaign for cancer screening. So you wanted to get people in to the specialty hospital to have those screenings done, preventative care.
Correct. It's important that they're thinking about prevention when it comes to cancer. So many times cancer is picked up with some test that was for some surgery or something that was coming along. And we want people to think more proactively and to take their health care into their own hands and let us help them do that. And so they should be getting those screens, those mammograms, those prostate exams, and those other exams that will help pick up some of the cancers that can be treated better if they're caught early.
Well, we have heard over the past few months some of the stories of the survivors that have found it in stage 3 and 4, and their recommendations of get in and get screened beforehand, and then have heard the stories of that finding it before it's too late.
That's right. There are both kinds of stories. There are those who in the screen got picked up, and those who were in the middle of something got picked up. Either way, the sooner the better as far as being able to use the miraculous treatments that are available to you to survive. And I think that's really the key, is to get in early and prevent some of the hazards and some of the problems that come from it if you miss it.
Absolutely. Well, there's a culminative effort here, and Runners North is where you pick up your packet for the race, the run of 5K, and this is May 7th?
That's right. May 7th, they'll start registering runners here on site in the parking lot between 8 and 9:30. The race is actually at 10, and then we anticipate that we'll be here till about 1 o'clock providing those health screens with different booths and so forth.
And you say right here, meaning the Cache Valley Specialty Hospital is where they're starting and returning.
Yes, that's correct. The race actually climbs around North Park area a little bit here, and it starts and stops here in the parking lot at Cache Valley Specialty Hospital.
Okay, very good. Now, you'll have a fair going on at the end, so there'll be different informative, there we go, booths and whatnot.
We'll actually have it before and after. We felt it would be helpful that they could come and register, and their family and friends could go through some of the booths. So we'll be here at 8 o'clock with our fair, and then it'll continue after the race, and we'll be here from 8 to 1.
Well, and I think that it's maybe interesting for those people who aren't running, if they want to get information, can they come down as well?
Yes, they can. We want the community to come because they'll support the runners. The main thing is we want to make sure that the information we have provided is given to them.
Well, my son and I are going to do the run, but we don't run, we walk, and I understand that that might be okay in this particular race because it is, again, about the community.
That's right. This race probably doesn't have the sticker rules that we're used to, so we're taking walkers, runners, bikers, whoever wants to be involved. I believe Heather with Runners North is going to accept all comers.
Yeah, which we love, absolutely. Let's talk again a little bit about the Specialty Hospital, Cache Valley Specialty Hospital, the location and the services.
Well, we're here in North Logan. We're on 4th East at about 2400 North, and we offer surgeries, both general as well as orthopedic. We have several other, we do radiology, we have mammography, we have digital CT, we also have physician clinics, we have hyperbaric and wound care. We have your traditional laboratory services, all the services that a hospital has. We provide those services, and we're really excited about the changes that we've made in our emergency room. It is truly now the premier emergency room. We've been able to staff it with the University of Utah physicians who are board certified emergency room physicians, which is that means their training has been specifically to emergency care, as well as their residencies have been to that, and they're certified. So we're really excited about the opportunities that our emergency room is offering the community. It certainly gives them a better choice to come.
Well, and I don't know that many people know that you have a choice. You have the choice of where to go, and even in an emergency room situation, if you are unfortunate in the accident, you can actually specifically say.
That's correct. You can specifically request to come to Cache Valley Specialty Hospital's emergency room. The ambulances are able to come here, and we're able to take care of you, and we're able to take care of you with better care than some of the other facilities in town.
Well, that is such wonderful news for us here in the community. Let's go back to that 5K run, May 7th.
May 7th, the race starts at 10, health fair starts at 8, and we'll be done about 1. Hope you come out.
That sounds great. Thanks so much.